Welcome everyone to today's live discussion. In this live program, usually we discuss on contemporary issues that is affecting our lives. We invite specialists as a guest and try to get expert opinion from them. We all know that people across the province are worried, are in tense situation. Students across the province are set to go to school in September 8, 2020. However, there is a wide range of criticism against the school reopening plan. Many parents are still hesitant in deciding whether to send their children to an in-person classroom or to keep them for remote learning method. There is a lot of uncertainty and misinformation, which makes it challenging for people to feel confident about their decisions. We have invited two distinguished guests, TDSB Trustee Michelle Aarts and Parthi Kandavel. They will discuss various aspects of the TDSB school reopening plan. Michelle and Parthi, I welcome you and I express my heartiest gratitude to both of you. I know you are busy people and you agreed, both of you agreed to join with me to discuss the crucial issue for the parents of this of the whole province. And as I was talking to you before we go live, both of you are actually representing most of the Bangladeshi people, Bangladeshi parents, because BCS East York and Scarborough Southwest, these two ridings, constituency, most of the Bangladeshi parents are living here. And so basically both of you are our representative. So first we will hear from you. If I start from Michelle, since I'm from Scarborough Southwest, so Michelle is my guest and Parthi is directly my representative. So I start from Michelle. Do you think, as many parents, many our friends are thinking, it is too early to reopen the classes? It is too early to ask kids go back to classes. What do you think? Is it actually early, or is it was required to open the classes now?
So there's been a variety of opinions in terms of our local community. I hear from both. I hear equally that my kids need to be back in school. My kids need the social interaction. They need to see their teachers. That that adult-child interaction with teachers is a really important relationship in their life. But I equally hear from parents who are saying, I'm just going to keep my kids home. And I will say that more of those parents that are junior kindergarten parents, their children haven't started school yet, so they feel like they can wait. Some have, medical reasons why, no matter what schools looks like, they're not sending their children back this year. And others are uncertain. There's medical experts have developmental experts have said school is important. It's important for socialization. It does need to start at some point. There needs to be something. Although the initial reports did not say that it needed to be full day, or it needed to be just that kids get a chance to go back and have continue their education and the socialization piece. With respect to different regions, there is a call for staggered starts and delayed starts. And actually, there was a letter today from our Toronto Public Health Agency calling for staggered starts again. And the staggered start would be that either in a school, especially a large school, so one of our schools in the area, Beaumont, and another close to us, Duke of Connaught, are over 1,000 elementary students. And right now they're supposed to start all on the same day. So a staggered start would make sense for, we have some schools that are very, very small. And the logistics of starting in one day aren't as big, but for a really big school, it would make sense to have some grades start, just ease them in over the week, so kids can get used to the routine. some people have called for staggered starts in terms of, older kids could start more independent learning at home and not be necessarily full-time, and whereas younger kids really need that childcare piece as well. And then the other piece around staggered starts for Toronto would really be looking at our communities, because this area, this southern area of the city, doesn't necessarily, there's areas where that there isn't high community transmission, but there's definitely other communities across our city that still have high community transmission. And it might be for some of those communities to say, let's give it another week and see where things are at.
Parthi, do you think like this is right to open school now, or it is too early?
First of all, thank you, Shaugat Bhai, for inviting myself and Michelle. We're very happy and to engage with the Bangladeshi and the Bangla community. Thank you for having us, and thank you for doing this show. It is a public service, as we feel our jobs are. So we appreciate your leadership. It's a good question. I think first and foremost, as Michelle mentioned, we rely on the medical expertise of our provincial medical officer, our local Toronto Public Health medical team, to give us advice. So we trust that judgment. The question is on logistics, as Michelle spoke to. Before I share, I'd like to, today I had a class. I'm as you may know, Shaugat Bhai, I'm a school teacher. I'm a grade 6 teacher at a private school, and every 2 weeks over the summer we've done online class reunions. And I was asking my grade 6s at 3 o'clock today, like, are you guys looking forward? And overwhelmingly, they're looking forward to starting school. And some of them are only children, and they've been at home and haven't had much of that very, very important social interaction at a young age. So I think from the social psychological development of a child, coming back is important. Parents have rightfully have concerns about that, and that's the situation we're in right now. I am confident to say there's different opinions, but I think if we do it correctly and properly, then a start in September is best for children and their needs.
Well, so both of you are thinking that the reopening of the timing for the reopening of the class in September is, according to the medical expert, is fit. It is correct.
Yes. Yeah, as Parthi said, a good thorough plan, and we have excellent staff that have been working for many months, working with public health on looking at all kinds of different safety protocols, on even leveraging spaces for like community centers and things, so that we can look at spreading out schools that are overcrowded. So there's been planning for many months. So I am really quite confident in our staff, because they're really, they are our education experts. They're good at their job, and there has been a lot of work. We know parents are uncertain because parents really want to know right now what their individual school will look like, and we just don't have those details yet. But the bigger plans, the safety pieces.
Or so far, what is declared, announced, so far what you know, can you please, from Michelle and both, I'm starting from Michelle, what is the exact plan right now? What TDSB is going to do from September?
Do you mean in terms of
look like what the student, our kids will do in the school? What will be the environment for them in the school?
So there'll be, in terms of it, like do you mean in terms of a school day? What will a school day look like for students?
Yes.
So there's still a few details going back and forth with Toronto Public Health. So in the early weeks, there will be active screening when kids get to school, when children get to school. There'll be somebody greeting them. There'll be somebody to say, to ask the questions. Have you had a fever? Do you feel like you've had any symptoms, or in your family? There'll be that active piece. There'll be somebody to greet them, to say, this is how, you're going to enter the school now. This is how you're going to this is what you're going to do when you go in. Here is your procedure for your behavior. Right now, also students will have, they'll have their designated classroom. They're going to be in their classroom cohorts. They're not going to be moving between classes or to the gym the way that they used to. So they'll be in their class or they'll be going outside. That there won't be as much, won't be as much movement in the hallways. Things will be a little bit stricter. And then I don't know if Parthi wants to continue with some of like where we're at with extracurriculars and other pieces like that.
Sure.
When you say cohorts, Parthi, I just add one point. When you say cohorts, Parthi, would you kindly explain for our parents, what do you actually mean?
So as a school board, we have some ability to develop the plans. The overall parameters are set by the Ministry of Education. So July 31st, which is only 2 weeks ago, but it feels like an eternity, the Minister, Stephen Lecce, announced that we would be returning to full class size from kindergarten to grade 8. High school would be the cohorts of 15 students and is, I would say a better situation in terms of class size and physical distancing. So K to 8 right now, the plans have not been finalized in terms of the class sizes. We have to work within the full class sizes. We're looking at maybe getting some additional money from the province to bring down the class size and maybe looking into our reserves, meaning we may have to run a deficit in order to, so that number of the class size, we still do not know. There's still 3 weeks and we need to have more discussions on, do we run a deficit budget to 2% as the province has allowed us in order to hire more teachers and to bring the class size down. So we are hoping that we do not have class sizes of 30, 35, as your viewers know, unfortunately, in our schools. So by keeping the students in a cohort, whatever that number is, will be beneficial in reducing the spread. So the students will be together with one teacher is the hope. Because of logistics, there may be another teacher that comes into the room, like the French teacher. And so those details are still being worked out. Lunches will be more, as Michelle said, more stricter in terms of exposure to other cohorts of kids. Sports will not continue until we have that green light from the medical community. Extracurriculars, after-school clubs will not be happening because we do not want children mixing. We recognize there'll be siblings. You may have a son in grade 4, a daughter in grade 6, and obviously they're coming from the same home, but those are certain pieces that are out of our control. The ideal is to reduce as much as possible the amount of interaction between different classes and different grades.
So, okay, so one thing what I understood from your explanation, that okay, from one class to grade 3, student of grade 3, they will not interact with student of grade 4, what we saw before this pandemic. And is there any idea, like there's one class, there will be maybe 20, 25 or 30 students, but there is any group, maybe 20, 25, or from grade 3 students, 25 or 15 students will be here, 15 students will be there, and there will be a whole day, they will not interact with each other group? Is
correct? Yes. Yeah, that's the idea, is that once a class is assigned to a teacher, that the teacher and that class stay together as a unit, and then they don't go collaborate with another class. They don't go play sports with another class. They stay together and they only directly interact with each other. I mean, they might see each other if they have a recess scheduled at the same time. They might be in a different part of the field, but again, they'll be distanced in the field as well. So it's to limit the physical interaction between those kids so that there's no transmission from one class to another.
just one question here, if you can read, Michelle.
Yeah, it's a good question, and I appreciate the viewer, for asking. Very important. So we have sent a staff survey to all our staff asking if they would like to be assigned work that is from home. For example, if a teacher feels they're not feels that if they are immunocompromised or in that situation, they can teach remotely. So there will be parents, as we know, surprisingly, a high number, not surprising perhaps, with good reason, choosing remote learning. They've already made the decision for their child. So that child will be learning from home. There will be a teacher that would be delivering the remote learning experience in a very structured manner from their home. So there will be teachers that will be teaching from home to the students that are who have chosen, those families who have chosen that option. So it won't be a teacher necessarily from that child's school, but it will be of course, TDSB teacher.
So basically, Mr. Mustafiz Rahman, our viewer who asked this question. So like we people with many home, there are older parents, maybe grandparents, maybe people with some medical conditions, diabetes, and other things. Yeah. So school will like the kind of screening. School will kind of screen all these things, whether any student, any parents, they have these issues, so they will encourage them to stay in remote class. Is that is the idea?
Sorry, could you repeat the last part?
The question is, say like there are many parents who have medical condition.
Yes.
So we know like this time we encourage people to stay like aware, like keep distance from people who have some medical condition. So if any kid, they are willing to go to classes, but their parents or somebody in the family have some kind of medical condition, how they will balance between this medical condition necessities and the willingness to go to the class?
So so that's partly a piece for the school and partly a piece for the individual families, because as you say, every family looks different, and so the conditions within their household, they have to make a decision that's the best for them. So I have heard from some parents who have said, I have one immunocompromised child and another in grade 3. I'm not sending either of them to school because for my personal reasons, it's too great of a risk. And they are not waiting to see what the class model will look like or how many students. They have already decided that this is too much of a risk for them. As I said, in some communities, the community transmission is low, but not citywide. Citywide, we still have an at-risk transmission rate of COVID. So so individual families have to take into account not just that they're sending their kids to school, but the same as any other behavior or any other activity in their life. If they're, if they have a medical condition that's so severe that they're not leaving the house at all, then probably a remote learning, they'd have to think about whether remote learning is a good fit for their family. And that should be, I would think that should be the priority, but acknowledging that, that students also need that peer interaction. So,
but like when some kids are going to school, and when my kids are like my friend is going to class and I'm not going to class, why is that? They can ask this question, and that is something embarrassing situation for the parents. And on the other hand, they have some safety issues. So I think like there is some kind of problem in the families, like with the kids. Oh, my friend is going to class, but I cannot go to class. What do you think, Parthi?
It's a tough situation, as Michelle indicated. It's the family decision, and I think that would involve, depending on how old the child is, for the mother and or father to speak with the child about the reality of the disease. I mean, of the COVID-19, and how it may affect somebody in the family, and how it's best to be on the safe side and to do the remote learning. It will be a tough request. I think all children will understand if you explain it properly that there isn't a point taking a risk, and that's why we have to continue until we're in a better place in terms of the numbers. So the child will feel sad, naturally. They want to see their friends and socialize and have fun and learn together. But I think we have to look at the bigger picture. If there's a member of the family who is compromised, to be careful. Yeah.
And it is, yes, please.
Oh, but if parents opt, they should understand if parents opt for remote learning for the start of school because they're concerned about the risk, they can come back. It's not forever.
Very good point.
We are going to set. Sorry, my chair keeps shifting.
This is many parents actually they are not clear about this. When you said they can come back, so what is actually time frame? Is there any time frame that they can change their mind and ask, like say today I have signed up for my kids that my kid will go for remote learning system, and after 1 week or maybe after 15 days or 1 month, I change my mind. Can I take my child to the class in after 1 month or 2 weeks or 3 weeks?
Yeah, so there will be clear entry dates. So at report cards, usually there's midterm report cards in November for elementary school. So that is a clear date where our system will say to parents, this is a good time if you want to come back. This is a good time to enter class. And then January, like after the Christmas break, that that there's a time there. But then individual families that change their minds can talk to their principal and say, can you accommodate my child now? And it might take a few days or a couple of weeks to figure out where to put them in the class. But then but there is a mechanism for a case-by-case return to school.
Yeah, we don't want children going back and forth. That's not what's best for the child. So that's an important message to convey to all parents. There will be the natural times to change, like report card in November, then January, but we all have different circumstances. Situation may change. A parent's employment may change. They have to go back into work. They can't look after a child, and that is a case-by-case scenario. The principal will work. It'll take a few days, as Michelle announced, and we have to remember the teachers are different. The classroom, whether it's the virtual or the in class, is different. So that's why our staff is saying to do it at the end of a reporting period, because it's a natural transition, because the child is getting used to a new set of students and a new teacher. And so not to go back and forth. When they make a decision, it has to be given a lot of thought.
Yeah. But the good thing is student, there are chance like the student, like we can even like as a parent, we can watch what is going on there. We can keep my kid in remote learning, and after some time, if we feel comfortable, we can approach our institution, school, and then there are chances to go back to classes. It is not that like we have to spend whole year to go back to the class. Am I correct?
That's correct.
That's correct. And it is confusing because some other school boards are making families commit for the year or
that's unfortunate. Which board do you know which boards offhand?
I think it's Upper Thames, where my sister-in-law teaches in Woodstock, and Lower Thames Valley. They have said no, if you opt for a remote, you're remote. But they have much less capacity. It's a much smaller boards, much less flexibility than a board of the TDSB's size.
So for TDSB, it is good thing that like we can be rest assured that like if we can certain point of time we can take my kids from remote learning system to classroom. Now the point is what our parents are thinking, because we know like from I think grade 4 mask wearing is mandatory from grade 4. So, do you think, Parthi, Michelle, uh, kids in grade 4, they will be able to keep mask all the time in class? They will not change with one friend with another friend. Oh, your one is good, or okay, take mine and or give me your one. But normally,
Oh, it's like sharing bubble gum. What a terrible thought. No, yes. I have two teenagers. I have a 7-year-old. We have been making our 7-year-old wear a mask when we go places. You know, and she's good. And actually, it's interesting because we have neighborhood children. They talk about these things. The younger kids, they notice that adults are wearing the masks. They talk about them. They see the socialization around masks. So it's not going to be. I know some parents are picturing that their kids might be in school like for 6 hours and have a mask on for 6 hours, and that's not the reality. There are going to be breaks built into the day. There's going to be outdoor time built into the day. They obviously won't be wearing them while they're eating. So for snack time, they'll have designated times where they're allowed to have a break. And especially emphasizing that outdoor time, so they get fresh air, and they can take the masks off when they're outside. I know staff are still working with Toronto Public Health on protocols for those breaks, because Toronto Public Health has stressed for all ages that the breaks are important, and they're important for staff too.
Mhm. Actually, as I'm going back into the classroom in a few weeks, I've been practicing wearing the mask for like an hour at a time. So I'm finding it a bit challenging, but I understand the importance behind it. I think many other uh, parents, staff, teachers, and students will be thinking about it. It's an important safety protocol at this age. On Tuesday, we're going to be considering the question of should kindergarten to grade 3 be wearing masks as well. And so that's something I know this weekend I'm going to do reading to better understand that question. I think there's a lot of importance behind it. So we have to make a decision, because many people have written to me, I know, and I know to Michelle as well, saying we should make it mandatory for kindergarten to grade 3 as well. And with that, if we make that decision, we need to think about the accommodations for children who will have asthma and other situations, and we need to think about the protocols and the breaks and how we structure it. So it'll be a very uncertain time, and I think we have to be very cooperative as a system, parents, teachers, students, and also thinking about the health and safety sometimes more than covering the curriculum. So it'll be a very delicate time to the first few weeks.
But when you say like it will be mandatory, mask wearing will be mandatory even from grade 3. So kids like grade 3, 4.
No, sorry. Right now it's mandatory for grade 4 to 8. On Tuesday, we're going to discuss as a trustees about kindergarten 1, 2, and 3. So all students.
So all students.
We are going to make that decision.
Like how it is possible to ensure that a grade 1 or 2 student that will keep mask on their face all the time in the school?
Well, it'll have to be part of the education plan. So there's actually a really good article that was just put out by the American Association for Pediatrics, and it looks at all of the other things in life that we make kids do, even for hand washing. So if you think about what's important, the things that have been considered important for safety for all of us when we're out in public, the things that the public health agencies recommend are masks, hand washing, social distancing, and not touching your face. And those are all pieces that we're going to have to build very strongly into our education because I know from my kids and my neighbors' kids that not touching your face, masks or no masks, not touching your face is going to have to be a really strong learning piece for most kids, but it's going to have to be, the education is going to have to be geared at the appropriate age. So how we teach kindergarten kids to keep a mask on, to wash their hands, to not bite their fingernails, not touch their friends. That'll have to be an age-appropriate education that will look different than the education piece for a grade 4 or a grade 8. But every grade is going to have to, and high school students too. Everybody, and there's going to be training for staff. Again, I see, it's very, absent-minded. We touch our eyes.
Yes.
It's going to have to be a constant education piece for all of those safety pieces. And I think some of the harder pieces for younger kids are going to be, don't lick your friends.
Another question from Himalaya, Parthi, Michelle, both of you can answer. Considering the current situation in US, where more than 100,000 students affected, what TDSB thinking of their full-size classes for elementary students?
Thank you. It's a good question, Emma. A couple of things. One is the good thing, our border is still closed. So that's a very important thing. Yeah, so, I think the data shows we've done a better job than the United States. Unfortunately, our cousins down there have, made some different decisions that we thankfully made at the right time, and we're in a better place. So the border is closed. That's good. The decision, Emma, to return to the full class size, many of us were not happy with that decision. It came on July 31st. It came from the Minister of Education. So us as school boards, and this is a very interesting exercise, people are understanding that we are not separate. The ministry and the school boards, we're very much connected. We get our funding, our curriculum, our policy, certain policies, and our parameters from the ministry. So they told us, they control us, they fund us, and I shouldn't say they control us, but they have a lot of influence and set the structure for school boards. So the Minister of Education made the decision to reopen to regular or full class size. So we have to follow that.
Yeah, and further to Parthi's points, like Parthi moved a motion for our staff that was approved. Parthi moved a motion that was approved by board last week to ask our staff to go back to the ministry and ask them to reconsider. Our staff did so much work developing different models, a variety of different models of back to school that had small class sizes, and there are options. They all cost money. They all cost quite a bit of money, but there are options. There are options in there for some lower cost models where we could hire more teachers and spread the classes out and have smaller classes, have classes of 15 or 20, depending on age. So we will keep pushing on that piece. We will try with the funds that we do have. We passed a deficit budget already. We're already borrowing almost $30 million to fund COVID costs. The ministry didn't give us additional money this week, but they said we could borrow more. We could run a bigger deficit, so we can borrow some more money. We're not sure of how much that is yet. Our staff haven't analyzed it yet, but we can borrow some more money, and we will use that money to hire staff to make them as small as possible.
When Education Minister yesterday, Education Minister was talking like they have you have access to reserve money. What does that mean?
So we have money in reserve, and it covers our liabilities, and it's set aside for some programs. So we have a small portion of the reserve money we have pays for some of our IT in the cost that we have that the ministry doesn't fund. It pays for some of our sustainability pieces in our schools. A very small part. A bigger portion of our reserves is our liability funds for our staff benefit plan. So it's part of our insurance. So it's money that has to be there. We're required to have that money in case of an emergency. School boards also use their reserves for pay for emergencies like a fire, a roof that just, a roof that needs to be repaired. It's emergency funds. We can't spend them, the reserves, we can borrow against them. So it's not really money we can just take and spend. We have to put it back. But for a short period of time, we can borrow money. Say like, you take out a loan on your house to pay for a new car. You have to put that money back, but you can borrow it for a short time to pay for the thing you need. So the province didn't hand us money, provincial money that we could go spend. They said we could just borrow more against our liabilities. So it's a little bit complicated. They did put a little bit of money aside for remote learning, and they did give a little bit of new money for ventilation. But it adds up to, the ventilation money only adds up to about roughly $5 million, just an estimate for the TDSB. So the money for ventilation is not given in a very timely manner because we start school in less than a month.
Mm-hmm. Okay, we take some questions. Mr. Din Mohammed, how will be the remote learning process? Will it continue Monday to Friday from 8:30 to 3:15 like regular school?
It's a very good question. When we moved to remote learning in March, right after March break, it was an emergency time period. It was brand new for everyone involved, especially at the elementary grades. So there was a lot of confusion. There wasn't the preparation, especially there's some great teachers in our schools who are more experienced, but they may not have had the digital experience to move to the online teaching world. It was brand new. The expectations were different. People had never experienced this, and there was variation between classrooms and teachers. And some parents were not as happy, or maybe not have been fulfilled in their learning expectations. So what we are very careful with in this new fall remote learning, it will be structured. For example, the older grades will have 4 periods of synchronous or live streaming instruction by their teachers. Each period will be 40 minutes. Of course, with the younger grades, K to 3, there would be obviously having them attention for even 20, 30 minutes would be a dream. So it would be modified for the younger grades based on their ability. So it's a very good question from Din, that we as a school system recognize that if we're offering remote learning, it has to be very structured with intention that it's quality. So parents are assured that if they're choosing for their child to be home, that there is meaningful delivery of the education. So good question.
Yeah, the other piece on that is that the TDSB moved all of the summer schools online this year. So there's elementary summer school was online, and all the high school programs were online. So the September programs aren't being designed from scratch. It's going to be much more regulated, and there's examples. And I've heard really great things this summer about the summer school programs at George Webster and D.A. Morrison. So I don't know if some of the community here has participated in the one at George Webster, but I've gotten feedback from parents on those 2 programs. So one's a earlier elementary and the other's a middle school program. And the feedback from parents on those programs really been great.
Another question, Mr. Kamaluddin Sarkar. Remote learning is not enough to deliver the total curriculum expectations. Why don't province design a teaching learning procedures with enough safety in the classroom?
Mm-hmm. That's a good question. I think all of us would ideally like a return to classes without the concerns about safety and transmission of COVID. The reality is we have to, as I indicated a couple of times, the province has told us that we have to go back to the classroom. The reality, many times you heard the number 15. That was a recommendation by some medical community that the ratio of 1 teacher to 15 students would be best, ideal for 2-meter spacing. That would be lovely. The reality is we need the funding to get the teachers to create that ratio, but also we need the physical space. And the reality of many of the schools, if not all of them, in Michelle's ward and my ward, we have very healthy communities. Our schools are either at capacity or above capacity. So finding rooms will be a challenge. We are looking at spending money to bring down class sizes in certain places. And if we go with the 15-20 model, we may have to transport children to schools that do have space. If we decide and if we are able to lower the class size, so there will be changes, again, depending on the money, because part of that is the physical space. Where do we need to find empty classes?
Another question from Mahmoud Jaman. Will online materials be available to in-class students as well?
Yes. So unlike before, so many of our teachers used Google Classroom to support their classes, but now it will be required. And so all teachers will have to maintain an up-to-date Google Classroom site for their class. And this is actually so in case students have to be kept at home. So if a child shows up, or if parents wake up one morning and their child has a fever or the sniffles, looks like they have a cold, we're asking them not to send their children to school. We're asking them to be kept home until they can be tested, or the symptoms subside and we're sure that they don't have COVID. And so we have to make sure that any child that presents with a cold or flu symptoms can stay home and still learn, and that the teacher won't be scrambling to figure out how to deliver teaching to them. So the plan right now is to have every classroom have a live or up-to-date Google Classroom, and that's how they will work. And there will be more flexibility if a child gets sick for any reason and needs to be kept home for a period of time.
Worst case scenario, if there is any student found positive, what will happen? Will you close school again, send them back to home, or what will happen?
It's a good question. So as many government institutions, we rely on the expert advice from our health medical community. In our case, it's Toronto Public Health. So they're working with our staff to develop what are called protocols, or the ability to tell us what to do when a situation happens. So that's a very good question. It's top of mind for many, many parents. And we are waiting, and we will have that ready by the start of school, so we know. And of course, each case is different. And as soon as that identification of a case has been made, we immediately contact Toronto Public Health, and they will help us make that decision and tell us probably what to do. Is it the class? Is it the school? Because those are very important questions.
Our IT department right now is, in addition to relying on Toronto Public Health and working closely with Toronto Public Health, our IT department is working on an app, sort of like the COVID Alert, the federal COVID Alert app, and it's going to actually track attendance, and so there will be more close follow-up. So if a child doesn't show up for the day, there'll be a different protocol to follow up as to why they're not here, and then a procedure for working with public health to determine whether that public health needs to go investigate a child being kept home.
Oh, that is a good idea actually, because somebody is not coming, any student is not coming to class, and school don't know why or what happened to them. You need to know for the safety of other student as well, even for the teacher. Now, we heard that in the newspaper, we read that 500, I think 500 nurses, government is appointing 500 nurses. What will be their role in the school, in the classroom scenario?
I don't think we know that yet.
We haven't got the details yet from, so they will not be TDSB employees. They'll be Ministry of Health employees, nurses. So they will, right now I understand they're doing the hiring of those 500 nurses for across the province. And my understanding is that a nurse would be assigned to a certain area. We don't know how many we will receive. And they would work with the local schools. They wouldn't be our employees, they would be the Ministry of Health employees, but work very closely as again, we have to be all cooperative between the different government bodies. So they would work with us to help in the schools.
So they are not the typical the part of school staffs, like the nurses that we are talking about. So
Yeah.
nurses will not be the part of school staff. Like there are teachers, other staff. Nurses will not be there.
So we won't have one nurse per school. One nurse will serve multiple schools. We don't know how many, and they will work with our staff to make sure, whatever the situation is.
And when we talk about like the appointing new teachers, this 2 weeks from now to start school, to start classes, if you appoint teacher now, when they will get training, how they will take classes in September or October?
Do you mean training for online or training for like safety
we
protocols?
are reading in the newspaper that and there are demand for new teachers to appoint in the school, because if you for the class sizes, there are not like the available plenty of teachers to teach student in the school. So, and we are reading in the newspaper that government planning to appoint more teacher in the school.
Oh, so we don't need to wait for the government for that. Our human resources department always maintains a list of approved teachers. So we have what's called a pool of teachers. They're called long-term occasional teachers, and they would fill in for a leave of absence, or they teach it for a longer time period than say a supply teacher. So they're available to fill like a maternity leave or a medical leave of absence. So our staff have been over the last few months expanding our pool, and I believe the last update was just over 4,000 teachers. We have 4,000 teachers that are actually hired or into the TDSB system as long-term occasional, and we will be able to redeploy those teachers more quickly. We don't have to go in September and try to find new teachers.
and also, Shaugat, we don't have to train the teachers. I think I know what you're getting at. They come trained. So now in Ontario, to become a teacher, you have to do a BA or any undergraduate bachelor's, and then apply for a master's of teaching. It's now a 2-year program. And one thing I'd like to use this opportunity is to encourage, especially the young members who are in high school right now in the Bangla community, to think about teaching. Yeah. I'm a teacher. I had a career switch. It's the best job. You affect the future of our society in a very deep way, profound way, with your students. So I hope if any parents and students are watching, that they encourage the young people and their families who are in high school or university to think about teaching. We're very fortunate in Ontario that we compensate and pay our teachers very well, better than the median and the average salary. And so it's a comfortable job. It won't pay you the highest in the land, but it keeps you comfortable. But more importantly, you do a very, very important service. And I think, the Bangla community knows the importance of educators and teachers. So I hope whoever's watching that, they encourage teaching in their family. And we in the Toronto District School Board, we're starting to do more important work in what's called employment equity, meaning that are we hiring teachers that are representative of our communities? Toronto is very diverse, and we need to do better as a school system to make sure that our hiring reflects our diversity.
Good to know. Hopefully, people from my community there will be interested to be teacher. I know, like we have so many, our so many friends. They are teaching in school, and so many friends they want to be a teacher. So hope more people will be encouraged by your advice. And another thing, like when you talk about like the supply teacher, they don't necessarily come to school and take class every single day to certain school. So they go to different school, different time. Don't you think that will be some kind of threat to the safety for the teacher or staff or student?
So there is a protocol being developed to keep supply teachers assigned to particular schools. I know in practice, technically supply teachers can teach anywhere, but in practice, usually a principal has a list of teachers that they call on regularly. So instead of just submitting I need a supply teacher for somewhere, a lot of principals will have somebody they know that they know well and how they teach, and they will be on the supply list. So there isn't as much movement as you might think around the system for supply teachers. Supply teachers sometimes also have schools they prefer to teach at. So it's not a free-for-all, but there will be a protocol in place to limit the movement of supply teachers from school to school, and how frequently they can, or the time periods that they can move from one place to another.
Another question, teachers don't have direct access on summative assessments through Google Class. Don't you think the evaluations will not be perfect?
Mm-hmm. It's a good question. I had to face that during March to June. And it's a question of adaptability. I think we don't, during periods of uncertainty, and this pandemic is obviously one, to be so concerned about whether a child performed. So I would use Google Docs to put my math tests up, for example. And that was a question I wrestled with. If a child is getting help or using the internet, whatever it is, it's something that's certainly out of our control. We do our best. It's about ensuring learning is happening. So to be worried if the final mark is actually representative of their learning and ability, now is not the time to be worried about it. It's worried about to see, is the child connected to the teacher? Is the child interested in learning? Is their mental health and well-being being taken care of? And many times as a teacher, I recognize if I deliver a good lesson, an interesting lesson, then the child is connected, their mental health and well-being is actually taking place. So I think to me as an educator, that's my priority. And I think our teachers are thinking similarly, that they're focusing on the learning and not on the final mark. So I know it has a different relevance at the secondary level, where people are very worried rightfully about their marks, and I think that's a different conversation. But ultimately, for most students, we need to worry about the learning.
And there are students like special need. They need special attention in the school and the class environment. Would you explain actually what safety measures are there for them in September school?
That's a really big question, actually, because there are so many pieces. Each child with a special need looks different. Sometimes those needs are behavioral. Sometimes they're a learning delay. Sometimes they're just a different style of learning. And so there is actually, I would think I would refer parents to the presentation last night that was the TDSB and PIAC webinar last night on Back to School, because there was a piece from staff explaining how the different protocols for different types of special education will work, because there is a plan, and our special education staff are really excellent, so they are developing plans for all those different pieces. I would say some of the more common questions I've gotten or concerns are students that are in what's called the HSP or homeschool program tend to move from class to class, and so they won't be moving the same way. And so some parents were concerned if those students would be clustered together with other HSP students, or they would be with their normal peers, their regular peers, the regular class peers, or in a bigger group. And the goal will be to have them in the regular classroom with the other kids of their age group, and have the support teacher come to them. And then there's for a support or a resource teacher, or for a special needs assistant, there will be extra additional protective wear gear for them to work closely with the student. And staff are working on protocols for behavioral incidents. So for students that would normally need some sort of intervention for a behavioral episode, there's existing protocols for supporting that student, and then there's going to be additional protocols for safety that take into account the current COVID situation.
We're almost like 1 hour we are talking, and thank you so much. We would conclude now. Before we conclude, friends, those who are listening to us, we were talking to Mission Aarts and Parthi, our 2 school board trustee, TDSB trustee from Beaches East York and Scarborough Southwest. Like they are greatly our representative. And before we conclude, from Mission and Parthi, both of you, what advice do you have for our parents in regards to take a decision to send their kids to school or to remote learning system? Do you encourage them to send their kids to school, or what do you suggest them?
It's really a personal choice, but I would say that the big thing, if parents are uncertain, to ask questions. So I've been on the phone all week. I'm sure Parthi has as well. I've been answering many emails, many phone calls. Sometimes parents just need to talk about the situation. They need to feel better about the decision. I think most parents who have called me have an idea of what they want. They just want to talk to someone, talk through and feel better about it, or get that advice by email. So it's really a personal decision. I would say parents really need to think about your child, their personality, their needs, what's your family situation, and make the decision that's best for you personally. And then know that, when report card times comes around, you can change your mind. In November, you can say, okay, we tried online learning and that's not working. And so we want to come back. So there is flexibility, but yeah, reach out and ask questions.
Very, very similar. I think it's a family decision. If you feel your child or children are mature enough, you can have that question. Ask them what they think. I think building that relationship, not just on this question, but as they get older, is very important. Building that relationship with your children, ask them what they feel. And as the adult, you make the decision. Look at your family's situation, the health of the family, if there's immunocompromised people. Also look at the data. If you Google City of Toronto COVID map, you see by neighborhood very detailed information on the number of cases. And if you feel your neighborhood is disproportionately affected, you can consider that. Usually it's in situations of high rise. We have the Macy apartments in the Denton and Teesdale neighborhood. So look at the data and make a decision based on your family, speak with your children and their ideas, get their feedback.
Yes, we will also arrange a few more this type of discussion. We are trying to get one or two medical experts from any hospital. We are in touch with them. So friends, when we get their time, we will let you know and you will be able to ask them your question as well. Michelle and Parthi, thank you so much. We are delighted and we are grateful to both of you. We know that you both are so much busy, and despite your busyness, you gave us time this afternoon and you answered to our questions. Hope we will get both of you in future when we have more questions and we need answer from somewhere. We will go to you, we'll invite you to answer those questions. Thank you so much. And friends, those who were with us for last 1 hour, my sincere thanks to you all as well. Thank you.
Thank you so much.
Thank you. Thank you, Shaugat Bhai. Thank you, Michelle.